In a world overrun with the fake, delusional, and disingenuous, he stands as a beacon of truth. He is Abuki Cabal. You are listening to Abuki Cabal.
Welcome to the Abuki Cabal Show.
What's going on, ladies and gentlemen? It is I, Abuki. Not really. This is the Abuki Cabal Show. I'm your host, Rodney. And I had a request from one of my viewers, followers, I hope. Not sure about that, but I'm sure he probably is. But anyway, there was some questions about Collin Powell's unfortunate passing. And there were some questions levied as to why did Collin Powell pass, even though he received vaccination. So, and that's a good question, a very, very good question. And I wouldn't expect a lay person to know that. But I mean, let's just address the fact that the shot has never professed, or anyone who has advocated for the shot has ever professed that the shot would keep you from being reinfected with COVID. Okay. So it was supposed to mitigate the symptoms, meaning it would decrease the symptoms and give you a better chance of living from it. If you didn't have any pre-existing conditions that would cause you to have a bigger hump to get over. And unfortunately, General Powell had a condition that would have made it extremely difficult for him to survive. We're going to cover that, and I'll try to explain that to the best of my ability, and try to help those who don't understand how this could have happened get some semblance of understanding about how this happened. I didn't cover this right away because I was really bogged down. I was working quite a bit, and also I am a veteran, so I served during the time when he was serving as Joint Chief. And I had a bit of reverence for him, as do many veterans that I know that served during the same time. So without further ado, we'll go ahead and we'll get on with it. Why did Collin Powell die of COVID-19 despite being vaccinated? Vaccines still work, doctors say. Okay. A second here. All righty. So here we have a statement that was released. And it basically says that the fact that former Secretary of State Collin Powell died Monday due to complications from COVID-19, even though he was vaccinated, doesn't mean vaccines don't work, experts say. Instead, experts say everyone should get vaccinated in order to protect people who, like Powell, are not fully protected by vaccines due to underlying medical conditions. Okay? And this, brief article did not cover what that ailment is. But we'll go ahead and we'll move over to the fact check. This was done by Reuters. Okay, fact check. Death of Collin Powell is not evidence that COVID-19 vaccines are ineffective. Medical history put him at greater risk, meaning his medical history. Okay. I can't stress enough how important gathering a medical history on a patient is, and that will determine largely how you will approach treating a patient as a physician or as a nurse. How effective certain treatments will be, what treatments should be undertaken, a lot of different things. So what we have here is, and I'll just go ahead and read the article and let you guys know, I won't spoil it for you. Social media posts have suggested that Collin Powell's death is proof that COVID-19 vaccination is ineffective. However, Powell's reported underlying health condition put him at a higher risk for breakthrough infection and serious illness from the coronavirus. One such post, fully vaccinated Collin Powell is dead at 84 from COVID. Trust the science. Here with similar posts. Okay, Collin Powell died from COVID and he was fully vaccinated. So what's the point of the vaccine? Wow. Okay, here's another one. Kyle Becker, Collin Powell untimely death destroys the media's narrative. Okay, you got Reuters reported on October the 18th, 2021, that General Collin Powell died at the age of 84 due to complications from COVID-19. Powell was fully vaccinated, his family said, and they have a link there for you to read the family statement. Powell had multiple myeloma, a blood cancer. A source who asked not to be named told Reuters. The condition reduces the body's ability to fight infection and puts people at a higher risk for severe COVID-19. Powell's longtime aide, Peggy Cifrino, reportedly told the New York Times, and they have a link there also with her statement, that Powell had been successfully treated for multiple myeloma and a cancer of white blood cells in the bone marrow. Okay. And if you know what the significance of white blood cells are, I mean, that's your body's defense mechanism. If your body is inhibited from producing white blood cells, you have no ability to fight off any kind of infection. You are so susceptible that puts you into a condition that basically makes you so vulnerable to infection that you can die from a cold. You know, from the most minor infection you could die from. And we'll cover that a little bit. Also, I used to work in a bone marrow transplant facility here in the state, and saw how bad that condition is. And usually those people have to get bone marrow transplants in order to be treated, as well as chemo and other treatments. And they are very aggressive, and it can be an ordeal for the patient if they survive that. Brings back bad memories. Anyway, in a Facebook post announcement, the passing of Powell, family gave no further information on whether he had received a booster shot, when he got ill, or if he had any underlying health conditions. According to the organization Myeloma UK, myeloma patients, even those in remission, are considered extremely vulnerable to COVID-19. This is because myeloma affects how well the immune system can respond to infection. It gives a link there. Okay, a large-scale analysis of the data in 4 countries of patients with myeloma suggests a high mortality in hospitalized patients with myeloma and COVID infections than non-myeloma patients. And it has another link there for further information. Scientists appear to agree that breakthrough cases in which the patient develops a serious disease and die are seen mostly amongst people over 60 years old with an underlying health condition. In August, Reuters reported on Israeli data on COVID-19 breakthrough cases. At the time, around half of the country's 600 patients hospitalized with severe illness had received 2 doses of the Pfizer vaccine. The majority had received 2 doses at least 5 months ago, were over the age of 60, and had a chronic illness known to exacerbate coronavirus infections. Okay, they've got a link there also. And I guess I'm going to stop there for a second because, one of the questions that I get all the time is, okay, these people were highly vaccinated now. Israel had a bump in their COVID cases. And the reason for that is because boosters had not been put into effect yet. But since Israel rolled out their boosters, that infection rate has dropped, only lending more credence to the fact that boosters are effective. Okay. And the preliminary data, which is something that a lot of lay people are not feeling comfortable with and that are questioning, because the data shows one thing one day and then it shows something totally different at the end of the week. That's because usually when gathering data, you give time to collect, and then you start breaking down the numbers and crunching the numbers. But we're getting numbers in daily, and they're releasing the numbers daily, which, in my opinion, is causing more distrust of the situation than is necessary or that's needed, because people are not trained to look at that data appropriately. So they come up with all kinds of scenarios as to why the data looks this way and why the data looks that way, when they're not used to even handling raw data and waiting for the finished product. People want long-term results, and long-term isn't here yet. People wanted middle of the road results, and middle of the road isn't here yet. They have no idea how tests are run, but they claim that tests haven't been done. And that vaccines haven't been tested, but they have been tested. So before you say things and before you distrust something, what I would suggest is your first thing is you need to clear your mind, and you need to read the information, look at the evidence, and go where the evidence takes you. Don't have an idea in your head before you even see any evidence or any data. And that's with anything. It could be with this medical situation. It could be with domestic violence. It could be with anything. It could be with some of the lies that they tell about Black people, Black men, our relationships, our ability to make a living, to earn money. It could be anything. You get the data and you look at who's presenting the data. Look at how the data is packaged, how it's presented. You peel all of that away like an orange, and then you get down to the core of things and use your mind. We all have what it takes to be able to effectively look at data, numbers, information, and to make a logical conclusion. You just have to allow yourself to do it. Don't move with emotion, move with purpose. And that's all I'm trying to get you guys to do. Okay? But using this man's death to bolster your claims that you shouldn't get a vaccine when your medical history is totally different from his. What he went through in the last days of his life is nothing compared to what another person the same age that didn't have multiple myeloma would be going through. So you have to look at things by case basis. And that's all I'm saying. Be open-minded. Okay, let's move on here. Okay, in September, Reuters reported that available data showed that most severe breakthrough cases occurred in people over 65, those who were immunocompromised, or among those who were immunocompromised. The latter group is recommended for a booster shot. There's the information right there at the link. Effective research quoted by the CDC shows that vaccines are highly effective at preventing symptomatic COVID, reducing the risk for COVID-associated hospitalization in older adults, and preventing infection. The CDC also alerts that fully vaccinated people who are immunocompromised may not always build adequate levels of protection after an initial 2-dose primary messenger RNA COVID-19 vaccine series. They should continue to take all precautions recommended for unvaccinated people. And there's the recommendations at a link right there. Okay, the verdict. Missing context. Collin Powell's death due to complications associated with COVID-19 is not proof that vaccinations are ineffective. Powell had a reported history of immune suppressing illness. This article was produced by Reuters fact check team. Read more about fact checking work, and they've got a link there. Okay, so if you want more information about plasma cell neoplasms and multiple myeloma, I've got it right here. I will add those to the link. But here's the National Cancer Institute, which gives you a brief synopsis about what's involved with plasma cell neoplasms, including multiple myeloma. And this is patient information, easily obtainable if you just go look for it. Okay, plasma cell neoplasms occur when abnormal plasma cells form cancerous tumors in bone or soft tissue. Your blood cells are created in your bone marrow. Okay? Your immune system is affected by your bone marrow. Okay? And other soft tissue. Okay? It says when there is only one tumor, the disease is called a plasmacytoma. When there are multiple tumors, it's called multiple myeloma. Okay? Explore the links on this page to learn more about multiple myeloma treatment, statistics, research, and clinical trials. Okay? I worked in this for quite a while, and I worked in it in the bad old days. And graft versus host disease, where you get a bone marrow transplant and, you have issues with the grafting process, and you start having rejection symptoms. If you want to know what that looks like, all you got to do is Google. Okay. That doesn't happen as much nowadays. We had some successes, and we had some huge failures, had to have people in rooms with negative airflow so that anytime you opened up the door, it would blow out instead of blowing in. So any organisms or anything like that would normally enter the room from the drafting process were blown out of the room as you entered to keep you from infecting the patient on the inside. So you had to have a special environment and a special isolation environment while treating these patients, or you yourself could introduce something into that environment, which could get them very, very sick. So that's nothing, to shake your head at. The condition that he had would have compromised his immune system enough to where he would have had to have protect himself quite a bit. So unfortunately, someone that he was around probably reinfected him with COVID, and that subsequently caused his unfortunate passing. Those are the facts. You know, if you want to learn more about multiple myeloma, I mean, it is a fascinating condition from the outside looking in. And one of those diseases that I hope is eradicated at some point in the future. It's not a good disease. Okay. It's got some other information down here for people coping with cancer, you know, treatment. It has a link here for treatment of plasma cell neoplasms and multiple myeloma. Again, I'll add this to the link. Okay. And my final one, I will read a little bit about multiple myeloma, and this is from the Mayo Clinic. Okay. Multiple myeloma is a cancer that forms in a type of white blood cell called a plasma cell. Health plasma cells help you fight infections by making antibodies that recognize and attack germs. In multiple myeloma, cancerous plasma cells accumulate in the bone marrow and crowd our healthy blood cells. Rather than produce helpful antibodies, the cancer cells produce abnormal proteins that can cause complications. Excuse me. Treatment for multiple myeloma isn't always necessary right away if the multiple myeloma is slow growing and isn't causing signs and symptoms. Your doctor may recommend close monitoring instead of immediate treatment. For people with multiple myeloma who require treatment, a number of options are available to help control the disease. Okay. And they've got signs and symptoms here. I guess we can go through the whole thing. Okay, signs and symptoms of multiple myeloma can vary, and early in the disease, there may be none. When signs and symptoms do occur, they can include bone pain, especially in your spine or chest, nausea, constipation, loss of appetite, mental fogginess or confusion, fatigue, frequent infections, loss of weight, weakness and numbing in your legs, excessive thirst. Okay, it says when to see a doctor. Make an appointment with your doctor if you have any persistent signs and symptoms that worry you. Okay, has causes. It's not clear what causes multiple myeloma. Doctors know that myeloma begins with one abnormal plasma cell in your bone marrow, the soft blood producing tissue that fills the center of most of your bones. The abnormal cell multiplies rapidly. Because cancer cells don't mature and then die as normal cells do, they accumulate, eventually overwhelming the production of healthy cells. The bone marrow myeloma cells crowd the healthy blood cells, leading to fatigue and an inability to fight infections. The myeloma cells continue trying to produce antibodies as the healthy plasma cells do, but the myeloma cells produce abnormal antibodies that the body can't use. Instead, the abnormal antibodies, monoclonal proteins and M proteins, and you heard about this, monoclonal antibodies, that's what they're talking about, build up in the body and cause problems such as damage to your kidneys. And the reason why it causes a bit damage to the kidneys is because all of these cells that can't be used, your kidneys and your liver act as a filtration system to get rid of, blood cells that die. Your liver, your kidneys flush out other impurities from your body. So if it overwhelms your kidneys, then you'll start going into renal failure. So it'll just start destroying your body's ability to filter out. Okay. Cancer cells can also cause damage to the bones that increase the risk of broken bones. A connection with MGUS, multiple myeloma, almost always starts out as a relatively benign condition called monoclonal gammopathy of undetermined significance. All right. MAGUS, we'll just say MAGUS. Mugus, like multiple myeloma, is marked by the presence of M proteins produced by abnormal plasma cells in your blood. However, in Mugus, the level of M proteins are lower and no damage to the body occurs. Okay, it talks about the risk factors. Risk factors: increased age. Your risk of multiple myeloma increases as you age, with most people's diagnosed in their 60s. Male sex. Okay, men are more likely to develop the disease than are women. Black people are more likely to develop multiple myeloma than are people of other races. Family history of multiple myeloma: if your brother, sister, parents of a patient or a person who's had multiple myeloma, you have an increased risk of possibly getting the disease. Okay, personal history of monoclonal gammopathy or of undetermined significance. Mugus. Multiple myeloma almost always starts out as Mugus. So having this condition increases your risk. Complications. Okay, the complications are frequent infections. Okay, myeloma cells inhibit your body's ability to fight infections. Bone problems. Multiple myeloma can also affect your bones, leading to bone pain, thinning of bones, and broken bones. Reduced kidney function. Multiple myeloma may cause problems with your kidney function, including kidney failure. Low red blood cell count or anemia. As myeloma cells crowd out normal blood cells, multiple myeloma can also cause anemia and other blood problems. Okay. If you want to go into diagnosis and treatment, you can look at that. It's interesting. And if you want to look at, what people look like when they undergo that treatment, you can Google that. I will add these links to so that you guys can, take a look at those. And, it's just not, it is not a good thing, to look at this the way that to use this like a lot of people are doing. And I dare say that some of these people know better, but they put it out there because they know that people will tag along, because it's like a snappy little tune that you can't get out of your head. Some of these people are just taking advantage of people's lack of knowledge and ability to disseminate some of this anti-scientific propaganda. And you guys, please be careful. Just be careful. Try to eat right. Definitely keep wearing your mask. I know people are telling you not to wear your mask. Wear your mask even if you're vaccinated. Okay. If you're going to be in crowds, I still say, that's just not a good idea. The virus is still out here. The numbers are still significant. People aren't talking about it as much anymore because people are just tired of it. But I look, for those of us who are still working in the field, we're tired of it too. We're tired of seeing people. We're tired of having to educate people. We're tired of having to deal with this. And it may be something that we just have to live with. So we're just going to have to take a mature and adult approach to this problem. And yes, some older people are going to die. Some people will pass from this, but our objective is to try to minimize the numbers of people who do die from this condition until we can stop this from happening. One of the reasons why, and people talk about gain of function and, people lying about what they were working on, the government is under no obligation to tell you everything that they're working on. Look what's happening now. You got all this information out here and you have no wisdom. People are just taking in information and running off, going in all kinds of different directions. And people are blaming ICU nurses for, the condition that people are in, blaming medical people for spreading the disease, all kinds of things, and it's just, if things were worse than this, I would be terrified to even try to imagine how people would act. The lights are still on, we still have power, we're not being invaded or anything. But then you tell people about a virus, about just doing minimal things to try to protect themselves. Even if you do not want to get the shot, you still have to wear a mask. You still have to watch people around you, because the person next to you might be immunocompromised, like the general was. And if you give that to that person because you're not washing your hands, because, you're just willy-nilly going around here being around everybody, then you can cause somebody to lose their life. It's not hard to see or connect the dots. So I'm not going to keep you guys any longer. I appreciate you guys liking, sharing, and subscribing. I want to thank Dr. Tiasan Johnson for the shout outs. Thank Green Gorilla for his shows. His shows are very well done and very informative. All the links that I have up there, I got too many people on here that give out too much good information for me to name them all. BGS, Dr. Anwar, I'm honored to be among you all. So if you guys would go and check those guys out too, and make sure that you like, share, and subscribe to their work as well, I'd appreciate it. I hope this is useful to you guys, and help a brother out. Help me get up to that 1,000. I appreciate you guys. Have a good night.
You are listening to Abuki Cabal, the analytical savage.
I feel like a motherless child, a long way from home.